So how successful is lens replacement surgery? Well, as a tool for decreasing dependence from spectacles, it's incredibly powerful with the lens technologies that we have available. What I found is that I can achieve 90% of my patients completely independent from spectacles. The remaining 10%, they tend to need them for reading specs, for looking at very small print, or trying to read for extended periods of time, particularly in dim light conditions. And that most typically will be when their patient's trying to read in the evening, when they're tired, lights down a bit low, their eyes might be a little bit dry. But even those patients have an extraordinary level of social independence from spectacles. And by that I mean excellent distance vision, driving, seeing the television comfortably without spectacles, read the menu in a restaurant without spectacles, and can go shopping, socialise with their friends, seeing things comfortably, playing golf, seeing the scorecard. So even those patients who are occasionally using readers, they're very happy and they have a really good range and level of focus. The patients who tend to need a bit of support, the things that can sometimes hold them back in the visual performance, a bit of dryness, but we can pick that up beforehand if they have a drier tendency. So I can warn patients in advance if they're more likely to need some help with readers afterwards. And sometimes if there is some other eye condition. So with some of my older patients, sometimes I'll find that they have some changes at the back of the eye in the retina, completely unrelated to the lens replacement. Identifying those changes forms part of our really careful assessment in the clinic. For some patients, the changes are such that actually I can't use multifocal lenses for them. And for some patients, we can, it just means that the performance won't be at quite the same level as somebody who's lucky enough to have a completely healthy retina and retinal function. So as with all the work we do, it's about careful examination, assessment, and customization of approach. With that approach, it's an extremely powerful and successful tool for decreasing dependence of spectacles, on spectacles for patients. As to when I choose lens replacement surgery or laser eye surgery, because we have Presbyon blended vision that is also very good for providing a range of focus for this age group of patients. This age group of patients where their own natural lens isn't working so well, they have presbyopia, they've lost that range of focus. It really comes down to prescription, tear film, and the changes in the lens inside their eye. If a patient has a crystal clear lens, a great tear film and quite a small prescription, laser eye surgery is awesome. Conversely, early cataract change, some significant dry eye, lens replacement, great technology. So as ever, it isn't that one procedure is brilliant and the other one is terrible. They're both excellent, but have to be applied appropriately to the right patients. And that's what we put a lot of work into in our clinic, in everything we've organised, we've set up, and the whole process that we've put in place to assess and look after our patients.